I'm Rebecca Gordon.
I'm Sylvia Gordon.
And this episode, we're going to talk about birthday rules, which seems like it should be pretty easy. You have a birthday, there should be a rule.
Nothing's easy. Because the states that do have birthday rules, almost all do it differently. So a lot of agents, when they get to a certain area in their area, a certain level in their career, they're like, I'm going to get a lot more non-resident licenses, or I'm getting a lot of referrals that are necessitating that I get a lot more states. And they're like, how hard can it be? How hard can it be? Then they're calling us up like, do you know what's going on in Oregon? And what is the deal in Louisiana?
I just did blank.
You got federal rules, you got state rules, and then you have insurance companies can do it differently too. So let's look at this wonderful graphic. Shout out to Jagger Esch at Medicare FAQ.
So awesome.
Oregon.
So first off, what is a birthday rule for those people who are new in their career?
So in these colored states, if you have a Medicare supplement plan, you can change it for it can vary by state, but typically for a similar or lesser benefit plan. So if you have an F, you can go to a G or an N. That's a key element because all these people with a high priced F that's really accelerating, they're healthy, they want off their F, they can go to a G or an N. People that you've sold a G could go to another G or an N without underwriting.
On their birthday.
In some period surrounding their birthday, dependent upon their state. Oregon, 31 days starting on your birthday. Idaho, 63 days starting on your birthday.
Beginning on your birthday.
Okay. Illinois, 45 days beginning on your birthday. But Illinois won't let it be guaranteed issue for people over 75. So they're protecting the insurance companies for the
65 to
for
75.
the extra older people. The other thing about Illinois, which is very weird, and Louisiana, is you can only move to another plan with your same insurance carrier.
Which is kind of really clever for those carriers to have done that. Keeps the business in-house.
Right. So California, I
Gotta
think, was
love
the original birthday rule state, which is 90 days, begins 30 days before your birthday, and then 60 days after your birthday. Nevada, 61-day window. Maryland, 31-day window. Louisiana, same as California. It's nice that we have at least two that could agree on what the birthday rule means.
Mind-numbing, I think.
So people call me and they're like, hey, can I switch plans? I don't want MedAdvantage because I'm on dialysis or whatever. And I'll say, well, what's your health? And they say, well, I'm sick. Okay. Are you in one of these states? And they say yes. Then I'm like, when's your birthday?
Yeah, right.
And they're like, why? I just had my birthday. Thanks for asking. Okay, well, call me next year because the only way you can move is using this rule.
Birthday states, are they fully commissionable or do they adjust commission because it's a birthday state, basically a guaranteed issue conversion?
Based on the state. Any of this is very much different by state. So some don't pay commission, some pay reduced commission, some the state makes them pay a commission, all over the board. In general, if your client can get through underwriting, always use that.
Yeah.
Okay, your favorite, Missouri. So Missouri's not birthday.
It's an anniversary state.
Your plan anniversary. So yeah, like nobody knows when their plan got started, right? 30 days before and 30 days after, that's a nice, easy window to remember.
So if you're effective April 1st, so you can March, May.
You got it.
Nothing to do with my birthday, only anniversary on my plan date.
And if you haven't sold in these states that have these rules, you can see these rules help people from being stuck on a plan if they're sick that accelerate price.
Yeah. So that's good.
But it doesn't help the carriers because they can't underwrite the block of business. They got to take everybody. Yeah. They're going to have higher rates. So you're like, what's going on in that state? Their rates are so high. That's what's going on in that state. Or how come hardly anybody files a plan in Washington State? There's not a lot of competition in Washington State. Why are commissions so much lower in Washington State? It's because anybody can move their plan to a lesser plan at any time of year.
Guaranteed issue. It just doesn't work. Anything guaranteed issue doesn't work.
Yeah, typically you don't make any money. So people are just like, I'm not going to deal with Washington. Okay, these are some great states. These are the states that have continuous open enrollment, like New York. So in New York, and a lot of FMOs don't work in New York. They want a contracted partnership. So a lot of big call centers I've seen don't have New York. They're like, we're licensed in all 49 states. They screw New York. New York, you can move year round. Their price is typically double of any other state. And there's hardly anybody there. There might be 4 carriers that are there. Maine has an open enrollment in the month of June. Da-da-da.
It's interesting
Vermont
that it's this
year-round.
group.
Yeah, the
So
Northeast.
That's not surprising.
The socialist
It's
Northeast.
called those unique states.
And then, this is not birthday rule, but I threw it in because Jagger had such a great graph on it. And these are the states that are not standardized. They don't have Plan F and Plan G. They have their own thing. It's a super pain in the butt if you're a new agent and you're like, yeah, I wondered what was going on with that. You got to build it or the core and the stand. It's crazy. It's just so, like people that are in Indiana, ours is very simple.
Simple.
Very simple.
Keep it
easy. To
easy.
deal with. And this is the core plan, Massachusetts, the 3 plans, and this is the Minnesota plan, and this is the Wisconsin plan. I've spent 25, 30 years of my career trying not to learn this.
I don't want to learn that.
When
It just
people call
seems
me
dumb.
when they call me from those states, I always refer them out. Like,
Yeah.
I'm like, can't do it. My brain's too full. Then, of course, we
That's
have the states that you do not have to require Medicare supplements to provide coverage if you're on disability and you're under 65. Every agent should have this on their phone or their bulletin board or their tablet. I don't know how people do business anymore. I put this stuff on my bulletin board.
We're old school. Make
Yeah.
a copy.
But especially
Tape it.
if you're getting like Michelle, she's getting a lot more non-resident license. So yeah, you got to have somewhere to quickly reference that the red states, if you're under 65, you're not getting a med sub. Now it looks like a lot of states allow a med sub if you're on disability. But some of those have it so jacked up in price nobody's going to buy it. So that's a misnomer. Like Florida, they got to pay you a commission and they got to price it normal. But the rest of the states aren't all like that. So if that's not enough to keep your brain full,
This has been the best day of my life. Good selling.
thank you.